I want you to stop what you are doing for just a moment and hold your hands out in front of you. Spread your fingers wide and take a good, hard look at them. Your hands have likely done a lot of work over the last 60 or 70 years. They might be a little weathered, maybe there are some sun spots, perhaps the knuckles are a little swollen from arthritis. We tend to look at our hands and see the story of our labor, our hobbies, and our age. But I want you to look closer, specifically at your fingertips and your fingernails. I want you to look at the shape of the nail itself. Does it look like the back of a spoon? Does the nail curve downward around the tip of the finger, looking rounder and wider than it used to? If you look at your finger from the side profile, does the nail bed look swollen, like a bulb? This is not just a cosmetic change. This is not just getting old. This specific change in the shape of your fingers is a major medical red flag known as clubbing, and it is often the very first, silent warning sign that your lungs or your heart are in serious trouble. Today we are going to explore a symptom that has been recognized by doctors since the time of Hippocrates, yet most people have never heard of it. We are going to talk about digital clubbing. It is a painless, slow transformation of the fingertips that happens when your body is chronically starved of oxygen. It is a physical manifestation of a deep internal problem. We are going to discuss why this happens, how to perform the diamond test, or Schamroth's window, test right now in your own home to check yourself, and exactly what diseases, specifically lung cancer and heart disease, this symptom points to. By the end of this video, you will understand that your fingernails are actually a dashboard for your internal health, and knowing how to read them could be the difference between catching a life-threatening illness early or finding it too late. To understand why your fingers would change shape because of your lungs, we have to look at the anatomy of your circulatory system. Your heart pumps oxygen-rich blood to every corner of your body, all the way to the tips of your toes and the tips of your fingers. When your lungs are healthy, they saturate the blood with oxygen. But when there is a chronic problem, like a tumor in the lung, or heavy scarring from pulmonary fibrosis, or a heart defect, the oxygen levels in your blood drop. It might not be a huge drop that makes you pass out, but it is a chronic, low-level deprivation. Your body is smart. It senses this lack of oxygen. In an attempt to fix it, your body produces a substance, a protein called VEGF, vascular endothelial growth factor. Think of this like a fertilizer for blood vessels. Your body releases this fertilizer to try and grow more blood vessels to capture more oxygen. Here is the problem. This fertilizer gets into your bloodstream. But because of the way your circulation works, this substance tends to get stuck and accumulate in the capillary beds at the furthest ends of your body, your fingertips and sometimes your toes. When this growth factor builds up there, it causes the tissue to swell. It causes the blood vessels to dilate and the soft tissue under the nail bed to grow thicker. This pushes the nail up and forces it to curve over the top of the fingertip. It is a slow process. It happens over months or years. Because it is usually painless, most people don't notice it happening until someone points it out, or until they try to put on a ring that no longer fits, or they realize their nails look like drumsticks. This drumstick appearance is the classic sign. But why is it so strongly linked to lung cancer? This is the statistic that should make you sit up and pay attention. Medical studies show that roughly 29% of people with lung cancer have this finger clubbing. In fact, for many patients, the weird shape of their nails was the only symptom they had before the diagnosis. They didn't have a cough. They didn't have chest pain. They just had these round, bulbous fingertips. The cancer cells themselves can sometimes produce chemicals that trigger this swelling. So, if you are over 60, especially if you are a former smoker or have been exposed to secondhand smoke or industrial chemicals, and you see your nails curving like this, you need a chest X-ray. It is that simple. It is the body raising a white flag saying, something is wrong inside. But how do you know if you have it? Sometimes it is subtle. You might look at your hands and think, well, maybe they have always been like this. This is where the diamond test comes in. This is a test you can do right now, without a doctor, in 2 seconds. It is also called Schamroth's window test, named after the cardiologist who discovered it on himself. Here is what you do. Hold your hands up. Take your 2 index fingers, the pointer fingers. Curl the other fingers into a fist so they are out of the way. Now, press the fingernails of your 2 index fingers together, back to back. You want the first knuckle of each finger to be touching. Now, look at the space between the 2 nail beds. Look right where the cuticles touch. In a normal, healthy pair of hands, you should see a tiny, diamond-shaped gap of light. This is because normal nails angle upward slightly from the cuticle. There is a natural space there. If you see that little diamond of light, congratulations. You likely do not have clubbing. Your geometry is normal. However, if you press your nails together and there is no gap, if the nails touch flush against each other all the way down, that is a positive sign for clubbing. The diamond is gone. This happens because the swelling of the tissue under the nail has pushed the angle of the nail upward and outward, filling in that natural gap. If you cannot see the light, you need to see a doctor. It is a simple geometric rule: if the angle changes, the diamond disappears. And if the diamond disappears, it means the tissue is swollen, which means something systemic is driving that swelling. Let's talk about the specific conditions. We mentioned lung cancer, which is the most serious and urgent concern. But clubbing is also a hallmark of other lung diseases that affect seniors. Pulmonary fibrosis is one of them. This is a condition where the lung tissue becomes scarred and stiff. It becomes like leather instead of like a sponge. Because it is stiff, it can't transfer oxygen well. The low oxygen triggers the clubbing. If you find yourself getting short of breath just walking to the mailbox, or if you have a dry, hacking cough that won't go away, and you have these curved nails, ask your doctor about fibrosis. It is often misdiagnosed as just getting old or asthma, but the nails tell the true story of long-term oxygen struggle. Another lung condition is bronchiectasis. This is where the airways become permanently widened and damaged, often due to past infections. Mucus builds up, bacteria grow, and the lungs are constantly inflamed. This chronic inflammation also drives the changes in the fingertips. And we cannot forget the heart. While lung issues are the most common cause, about 80 to 90% of clubbing is lung-related, the other 10 to 15% is often the heart. Congenital heart defects, which are structural problems you might have been born with but managed to live with, can cause this. But more relevant to our age group is infective endocarditis. This is an infection of the heart valves. Bacteria enter the bloodstream, maybe from a dental procedure or a surgery, and latch onto the heart valves. This infection can shower the body with septic emboli and cause immune reactions that lead to clubbing. If you have had a recent fever, fatigue, and your nails are changing, your doctor needs to listen to your heart for a murmur immediately. I want to distinguish this from other nail problems because, at our age, our nails get weird. We get ridges. We get fungus. We get brittleness. It is important not to panic over the wrong thing. Clubbing is about the shape and the foundation of the nail, not the texture of the nail plate itself. If your nails are thick, yellow, and crumbly, that is onychomycosis, toenail fungus. That is gross, but it won't kill you. That is an infection on the surface. Clubbing is smooth. The nail itself might look perfectly healthy, shiny, and strong. It is the bed underneath that is the problem. Also, we need to talk about arthritis. Many of you have osteoarthritis or rheumatoid arthritis. This causes swelling in the joints, the knuckles. Your fingers might look crooked or swollen at the middle joint. That is not clubbing. Clubbing is specifically the very tip of the finger, the distal phalanx. It often looks like the end of a matchstick. If the swelling is at the nail, think lungs. If the swelling is at the knuckle, think arthritis. Of course, you can have both, which makes it tricky, but the diamond test usually still works even if you have arthritis because it focuses solely on the nail angle. Let's go deeper into the why. Why do we ignore this? I think it is because it doesn't hurt. We are trained to react to pain. If your arm hurts, you go to the doctor. If your chest hurts, you call 911. But if your fingers just get a little rounder, you figure it is just water retention or weight gain. This is the danger of the silent symptom. The body is incredibly resilient. It will compensate for low oxygen for years before it finally crashes. The clubbing is the compensation. It is the body trying to adapt to a hostile environment. It is trying to increase blood flow to the extremities because it feels like it is suffocating. By the time you feel the crushing chest pain or the coughing up blood, the disease is often in the late stages. The nails give you a preview in the early stages. There is a psychological aspect to this too. As we age, we often feel like our bodies are betraying us. We see wrinkles, we see liver spots, we see veins. We stop looking closely because we don't like what we see. We stop inspecting our bodies because it reminds us of our mortality. I want you to flip that script. I want you to look at your body with curiosity, not judgment. Your body is communicating with you. It is sending you signals. Ignoring them doesn't make the problem go away, it just removes your head start. If you do the diamond test today and you don't see the light, if you have clubbing, what is the next step? First, do not panic. Panic raises your blood pressure and helps nothing. Remember, there is a small percentage of people who have familial clubbing. This means it is genetic. If your father had round fingers and lived to be 95, and your grandfather had them, and you have had them since you were a teenager, it might just be your genetics. But if this is a change, if you used to have normal nails and now they are curved, that is the key. Change is the enemy. The next step is to make an appointment with your primary care physician. You don't need to run to an oncologist yet. Start with your GP. When you go in, show them your hands. Say specifically, "Doctor, I am concerned about finger clubbing." Doctors are busy. They have 15 minutes with you. They are listening to your heart, checking your blood pressure, typing on their computer. They might not look at your fingernails unless you put them in their face. Be your own advocate. The doctor will likely order a few simple tests. The first is a pulse oximeter. You know, the little clip they put on your finger. It measures the oxygen saturation in your blood. If you are sitting there breathing normal air and your oxygen is 92% or 90% instead of 98%, that confirms the hypoxia theory. Then, they will order a chest X-ray. This is a cheap, fast, non-invasive picture of your lungs. It can spot a large mass, fluid, or significant scarring. If the X-ray looks suspicious, they will move to a CT scan, which is a 3D map of the lungs. They might also do an echocardiogram to look at the heart valves. These tests are standard, covered by Medicare and insurance, and they are life-saving. I want to talk about the concept of paraneoplastic syndromes. That is a big medical word, but it is fascinating. Lung cancer is a tumor. But tumors are not just lumps of meat. They are biologically active. They secrete hormones and proteins. Sometimes, the symptoms you experience have nothing to do with the tumor's location, but everything to do with the chemicals it is releasing. Clubbing is a paraneoplastic syndrome. It is a side effect of the cancer's chemical warfare. Another one is hypercalcemia, high calcium in the blood, which can make you confused or thirsty. Or hyponatremia, low sodium, which can make you weak. If you have clubbing, and you also feel incredibly thirsty, or incredibly weak, or confused, these are all dots that connect back to the lungs. Let's touch on the lifestyle factors that complicate this. Smoking. If you are a smoker, or if you smoked for 20 years and quit, you are in the high-risk category. We know this. But many people think, I quit 30 years ago, I'm safe. While your risk drops significantly, it never goes back to zero. The damage done to the DNA in the lung cells can sit dormant for decades before mutating. So even if you are a former smoker, you cannot ignore the nails. And for those who never smoked, radon gas is the second leading cause of lung cancer. It is an invisible gas that seeps up from the ground into basements. If you have clubbing and never smoked, test your home for radon. It could be the environmental trigger. There is also a condition called hypertrophic osteoarthropathy. This is the fancy medical term for what happens in clubbing when it gets advanced. It can actually become painful. The periosteum, the lining of the bone, in the wrists and ankles can start to grow new bone. This can cause a deep, burning ache in the long bones of the arms and legs. If your fingers are round and your shins ache deep inside the bone, this is a very strong indicator of a lung malignancy. It is not just growing pains or arthritis. It is the skeletal system reacting to the lung disease. I want to broaden the scope for a moment. While clubbing is the most dramatic nail sign, there are other nail signals you should look for while you are inspecting your hands. Pale nails. If your nail beds are very pale or white, instead of pink, this is a sign of anemia. You lack red blood cells. This puts strain on the heart. Blue nails. This is cyanosis. This means you don't have enough oxygen right now. It is an emergency. Splinter hemorrhages. These look like tiny little red or brown splinters running vertically under the nail. You think you got a splinter, but you didn't. These are actually tiny blood clots that have burst in the capillaries. If you have many of these, it can be a sign of that heart valve infection, endocarditis, or vasculitis. Horizontal ridges, Bowes lines, deep grooves that run across the nail. This happens when the nail stops growing for a while due to a severe illness, like a high fever, a heart attack, or chemotherapy. It is a historical record of a trauma your body went through months ago. Your nails are like the rings of a tree. They record your health history. But clubbing is unique because it predicts the future. It tells you what is developing. Let's go back to the diamond test one more time. I want to make sure you are doing it right. It is not just touching the tips. It is about the base of the nail. You have to align the cuticles. If you have long fingernails, it might be harder to do. You might have to look from the side. Or, take a single finger and hold it up at eye level. Look at it from the side profile. The angle between the skin of your finger and the nail plate should be about 160 degrees. It should dip down. If it is 180 degrees, flat, or greater than 180, bulging up, that is clubbing. Imagine a drop of water sitting on your nail. On a normal nail, it would slide off the side. On a clubbed nail, it would balance right in the middle because the nail is so round. Why is this information vital for the 60-plus audience in the USA? Because we are the generation of toughing it out. We are the generation that doesn't run to the doctor for every little ache. And generally, that resilience is a good thing. But in this specific case, resilience is deadly. You cannot tough out lung cancer. You cannot mind over matter a heart defect. You need intervention. And the earlier the intervention, the smaller the surgery, the higher the survival rate. Lung cancer has a stigma. People think it is a death sentence. But early-stage lung cancer is treatable. We have robotic surgeries, we have targeted immunotherapies, we have treatments that didn't exist 10 years ago. But they only work if we find the tumor before it spreads. The fingernails are the scout that finds the enemy early. If you check your hands and you see the clubbing, you might feel fear. That is natural. But I want you to convert that fear into action. The fear is there to mobilize you. It is adrenaline. Use it to dial the phone number. Use it to drive to the appointment. Do not use it to freeze and hide. Denial is the only thing that guarantees a bad outcome. And if you check your hands and you see the diamond gap, if you see the light, take a deep breath of gratitude. Your lungs are likely doing their job. Your heart is pumping well enough to oxygenate your fingertips. Appreciate that. But don't stop there. Check your spouse's hands. Check your siblings' hands. Next time you are playing cards with your friends or having coffee, take a glance. You might be the person who notices it. You might be the one who says, "Hey, Bob, have your fingernails always looked that round?" You could be the person who saves their life. It is a strange conversation to have, yes. Let me look at your fingers. But it is an act of love. We often look for health in complex places. We look for it in expensive supplements, in fad diets, in genetic testing. But sometimes, the most profound diagnostic tools are built right into our anatomy. Nature has given us a warning light. It is right there at the end of your arm. It costs nothing to check. It takes seconds to interpret. Let's review the mechanism one last time so it sticks in your memory. Low oxygen, the lungs or heart struggle to oxygenate the blood. The fix, the body releases growth factors, VEGF, to try to build more vessels. The traffic jam, these growth factors get stuck in the capillary beds of the fingertips. The swelling, the tissue grows, the vessels dilate, and the nail bed puffs up. The curve, the nail is forced to curve downward, losing the diamond gap. It is a chain reaction. Breaking the chain requires finding the source of the low oxygen. I want to leave you with a thought about your hands. Your hands are your primary tool for interacting with the world. You use them to hold your grandchildren, to cook your meals, to drive your car. They are essential. If they are changing shape, they are screaming for your attention. Listen to them. So, please, take a moment today. Do the diamond test. If you see the light, keep living your healthy life. If you don't, pick up the phone. It might be nothing, it might be genetics or a quirky variation. But it might be the sign that saves you. And when it comes to your lungs and your heart, it is always, always better to be safe than sorry. Thank you for listening. I know this can be a scary topic, but knowledge is power. You are now armed with a diagnostic tool that even some medical students forget to use. Use it. Share it. And take care of those hands, and the lungs that fuel them.